Perfect. So welcome, Taylor. We're super excited to chat with you today about all things immunity. Before we get started, I'll introduce myself. Andrea will introduce herself, and then we'll introduce you.
Perfect.
So just to start off, hi, I'm Alexia from NutraChamps. I'm one of the social media specialists here, and we love having conversations with people within the wellness industry who specialize in what they do best, which is helping others, giving amazing tips about how to take care of yourself on the inside and out. And when we saw your Instagram profile, we saw that's exactly what you do. You have a really radiant, way about you, and
Thank
definitely
you.
wanted to learn more about what it is you do to help others in this space. So we're really excited to chat, and Andrea can introduce herself.
Yeah, so I'm Andrea, and I'm gonna say ditto. She said that so perfectly. We are so excited to talk to you. Everything about your profile and what we know about you so far has been inspirational, motivational, and can't wait to jump into this conversation.
Perfect. Well, thank you. And I'm excited to be here. I love obviously sharing my expertise and just have a passion for, helping others get better, stay better, and all the things. So
Lovely. Well, as I saw on your Instagram profile, I want to get the full title right, so correct me if I'm wrong. But you're more than one thing. You're a functional medicine physician associate,
right.
and a registered dietitian nutritionist.
Yep, correct.
Amazing. And I would say it seems like your main passion is about healing the root cause when it comes to our health.
Exactly.
Amazing. Please feel free to add on to that and let other people know a little bit more about you.
Yeah. So my background, just in a nutshell, kind of make a very long story a little shorter. I grew up in a household where my dad was a physician, my aunt and uncles were physicians too. So very medical based family. So I feel like it was in my blood from the beginning. I was pre-med in college, and I took a food science and nutrition class, and I just fell in love with just food as medicine and just how we can help our bodies through food and, what we're putting in our mouths and how we're eating and everything like that. So I quickly changed my major to nutritional sciences and went to RD school, or registered dietitian school. And I just remember back in RD school, I was sitting in class and we were learning about like FDA recommended diets. And I remember thinking to myself, like, there has to be something more than what we're learning. Like, I want to help people heal through food and like a food as medicine approach. And that wasn't, unfortunately, really what I was learning in school. So I found more, I think, first integrative and Ayurvedic medicine first, when I was still in RD school, kind of searching for something more, what I was passionate about. And to put a layer on top of that, like a lot of other people in this field, I had some of my own health issues I was struggling with that kind of got just pushed to the side in the conventional realm. So I was kind of trying to help myself, my own GI issues, and then also just trying to find my passion and how I wanted to practice as a dietitian. So I was very lucky that out of dietetic school, my first job was in an integrative and functional medicine clinic. So I hit the ground running, and it was from there, I was sold. I was doing a ton of webinars, graduate certificates, other certifications in functional medicine. So I just was, dive deep in first and was just kind of living and breathing what I was passionate about. I actually started my own business as a registered dietitian, and I was partnering with clinics and seeing patients in the Oklahoma City area. And then I got recruited to work for a top functional medicine practitioner at the time, Dr. Amy Myers in Austin. So I moved down there and became her dietitian. And it was there. I loved being a dietitian. I loved working with my patients. I would do nothing else, in the, as far as no other field but functional medicine. And I just kind of realized I was limited in my scope of expertise as a dietitian, that I, always wanted to talk about food and food as medicine, but I wanted to be able to assess and treat the whole person. So it was there I realized, well, I'm either going back to med school or I'm going to like PA school, as an example. So I went back to physician assistant school. And so I went back knowing that I didn't want to be in any other field but functional medicine. So I was already in that world. I was conventionally trained. So I went back to a conventional PA school, which was good for me because I now know both sides of medicine, right? Like I know the conventional training, but I also know, of course, and am passionate about that root cause approach. And we can always talk about the difference later. But since then, I graduated and I've worked in a couple different functional medicine clinics, and I have gotten my Institute for Functional Medicine certification, which I got this last year, which has always been a goal of mine. And that's kind of where I'm at currently. So it's been a long journey, but I'm just so thankful that I've done, both sides of medicine, but also worked as a dietitian and now as a PA, because diet is so important no matter what we do and what.
Oh, you just froze there for a second. Diet, you said diet is so important no matter what we do.
Yep. And to what we're trying to heal and optimize. We always have to work on optimizing our diet in addition to other things too.
Yeah. What an amazing overview of your journey. And it sounds like you've learned so much along the way. And it's interesting how so many people who get into the field of, I find, like more root cause work, it's because they've gone through their own health challenges, right?
Agreed.
And had to go and do that healing. So I'm not surprised that, this led you down this path, because what better way to be passionate about something than to experience it yourself and to be able to heal through it, right?
Oh, absolutely. And I think we kind of just realized that, there's a time and a place for conventional medicine, acute care, it can be life-saving. But when we're thinking about chronic disease or long-term issues, sometimes conventional medicine only offers so much. And where functional medicine really comes in, obviously we're looking at a root cause approach, but we have more tools in the toolkit to dig deeper and really find, what's going on, contributing to symptoms, and hopefully resolving those symptoms rather than just band-aiding the symptoms.
Yeah, that is so amazing. Honestly, everything I can it totally resonates with me. And it's exactly what feel like I've been consistently going through. Like I started not really knowing where to go, and then I gradually figured out that there's a lot more to it, a lot more depth to it. So it's really interesting to hear you chat about that too. And why do you believe wellness is important in general?
So, I think when, I first of all think like what is wellness, and it might differentiate or be different to each individual, right? So for me, really being well is feeling good, of course, having vitality and endurance, and it's not just not being sick or being free of disease, but it's feeling good to just really live out my calling, and that I can help others and I can have a full cup that I can pour out from, right? So I think when I think of wellness, I think of an abundant life, or having vitality too. So of course, I would say it's important just because people, they want to feel good. They want to feel good to live out their purpose and their calling. And I think when we think of wellness too, it's not just absence of disease, it's just not being sick. It's, our physical health, but also our mental health and our social connections and our relationships and our time in nature and our mindset. It incorporates movement, so much else than just what might be going on mentally and physically. So that's kind of my 2 cents on that.
Yeah, I couldn't agree more. I could not agree more. When I am personally treating myself the best I possibly can in every area of my life, that could actually just be prioritizing hanging out with a friend. Like something as small as that. When I prioritize that, when I do that, I actually have so much energy and just feel so much better to put that towards other things in life. And yeah, I couldn't agree more.
Yeah, thank you for that answer. Since some people might not know, what would you define as functional medicine? Like what does that term mean?
Yep, that's a great question. And I think that thankfully functional medicine is becoming more and more well known. But like when I started out in this field, like 10, 12 years ago, it wasn't as well known. So, so basically how I like to explain this to people is I feel like, you know, you have two sides of the spectrum. You have conventional medicine. So that's typical, conventional medicine where, you know, I was trained in PA school. You have a patient that comes in with certain symptoms, you work it up, you diagnose them, and then you treat them. And a lot of times that includes a prescription or a surgery or a referral, right? And then on the other hand of the spectrum, you have alternative medicine, which usually uses no medicine. They might use herbs and tinctures and mind body therapies, etc. So there's a happy blend in the middle, which is integrative medicine, right? And so that takes some where some medications are necessary, uses some medication, but also might use some supplements and some herbs, etc. And then I like to say functional medicine takes it even one step deeper, where it's a blend. So I practice integrative medicine where I do prescribe some medications when necessary, but it's usually not my first option. But I also recommend, you know, herbs and supplements and lifestyle recommendations. But functional medicine is taking it a step deeper to look at the root cause. So if I have a patient, they might present with certain symptoms, I'm working them up, I'm diagnosing them, but then I'm looking at underlying dysfunction. So like a great example is hypothyroidism, for example, right? So, you know, conventional medicine, patient presents, they get diagnosed with hypothyroidism and are usually just put on a thyroid medication. Whereas functional medicine, I do everything that a conventional medicine practitioner would do, right? You know, see the symptoms, work it up, do a physical exam, diagnose and treat, and time and a place for medication. But I'm always asking myself, like, what is the underlying factor or factors that are causing the dysfunction in the first place? So, you know, for hypothyroidism, is it autoimmune related? Is it due to nutrient deficiencies or high stress, high cortisol, gut dysbiosis, things like that? So I love it because I'm like an investigator for every patient, but it's really looking at the root cause, and it is an evidence-based approach. So it's not some woo-woo snake oil, you know, it actually is evidence and science-based.
I love that.
Wow, that's really interesting.
Yeah, I know it is something that's fairly new because
Right.
I don't hear too many people saying that they're in the realm of functional medicine or that's an industry they want to get into. But I feel like it's the future because it combines two things that are both necessary and in different ways. So
And it is good medicine. And I think that's where people, and I even see, and I love when other PAs reach out to me like via Instagram and say, I love what you're doing. How do I get into this field? Because people are realizing, you know, and especially physicians and PAs and nurse practitioner, they're realizing they don't want to just give a pill for every ill. Like they want people to get better. Like, and so, and not, again, not saying that, you know, I prescribe certain medications. I'm definitely not anti-medications, but to really find healing and prevent further disease, we got to look one step further.
So we want to just chat a bit about immunity because it is flu season.
Yep.
What are some ways to boost your immune system naturally? I'm talking food, diet, supplements, lifestyle. Any tips and tricks there?
Yep. So I have quite a few. So I'll try to kind of go through these one by one in a sense. So of course, my background as a dietitian, I'm going to talk about food first. So I would say to be preventative, you know, we want to have a good anti-inflammatory, color-rich, diverse diet. So we want to limit or reduce as much as possible, you know, too much sugar, too much alcohol, processed foods, you know, fast foods, fried foods, etc. And we want to fill our plate with, you know, lots of good, healthy, colorful fruits and vegetables, you know, high quality, ideally grass-fed, grass-finished, organic meats, healthy fats, etc. You know, we want to stay well hydrated, which is really important. And if you can drink filtered water, the better, right? You know, lots of non-starchy veggies. I tell my patients, now this isn't always doable, and I'm also very realistic, but this is a goal. I tell my patients, I want you to eat every color of the rainbow every day. So have that be a goal. Plate every color of the rainbow every day. Or some people like to do this instead, 30 different plants every week. So diversity. I think so often we get stuck, and most of us are creatures of habit. This is hard for myself. I can first admit that. We get stuck in, oh, I'm eating just blueberries every single morning, and I'm eating a banana every day as a snack. But we got to have diversity. So I would say that's really important. Those colorful antioxidant rich foods, are really going to help support our immune system. You can take it one step further and say you're going to eat foods higher in immune system supportive nutrients like zinc, vitamin A, vitamin D, vitamin C. And then there's also certain foods, especially herbs, can be very medicinal, but like garlic and onions that can have anti-inflammatory, but antiviral properties to them too. So I'd say, my first and foremost thing is, clean diet, right? We can take it a step further, and this kind of goes along with diet. And then if some people want to supplement with these things, that's fine too. I'd say my kind of top immune supports would be like vitamin C, optimizing vitamin D levels, vitamin A, and zinc. For me personally, I try to take a food first approach and get them through food. But if I'm coming down with an illness, that's when I start supplementing, and we can touch on that later. But vitamin C is critical for our immune system. When we think of vitamin C rich foods, we think of course, citrus, kiwis are a great source, bell peppers, strawberries, tomatoes, etc. Vitamin D, I like to optimize my patients' vitamin D levels. I always check a vitamin D on a new patient, and ideally once or twice a year on people. And personally, I like that level to be between 50 and 80. Is where I like it personally. A lot of times I'm having to supplement to get there, depending on where people live and sun exposure. But if people prefer to get it through natural sunlight, 10, 15 minutes of sunlight per day, they could choose foods rich in vitamin D, like some fatty fish, or take cod liver oil. That could be another one too. And then, vitamin A, super important for our immune system. Cod liver oil is another great source. Organ meats, if people are consuming organ meats, or, I feel like it's very popular to take organ meat capsules now, but that could be another source. And then of course your beta carotene, orange rich foods, sweet potatoes, carrots, etc. And then zinc. So zinc, one of my favorite sources is pumpkin seeds. But mushrooms, lentils, hemp seeds have zinc. So I'd say those would make up, a healthy diet, or things people should include when they're looking to support their immune system. Then that's kind of from a food perspective. And like I said, supplement too. And then of course, there's some things that are critical in addition to that. So something, and you guys, I'm sure, are aware of this, gut health, right? So our gut is so important. We know that more than 70% of our immune system is in our gut. And so if our gut is not healthy, we might get more sick frequently. We might not handle illness as well and fight it off as well. So that is so important. That's something I usually treat, work up, optimize in every single patient that I have, is their gut. And, there's ways we can support that. Obviously, if you could work with a functional medicine provider and do some detailed stool testing and treatment, awesome. If you can't do that, you can take a good probiotic or rotate certain probiotics. You can eat prebiotic and fiber and resistant starch rich foods. Again, diverse diet. There's a saying, like diversity in the diet equals a diverse microbiome. And that's what's really important for overall gut health. So those are some foundational things. There are a couple other things I would say that I can kind of name quickly. And then if you want to go over them, I'm happy to go over them more. Washing your hands, it sounds silly, but it is really important. Washing your hands, and maybe going a step further to have like good non-toxic soap, I always tell my patients to have good nasal hygiene. So I have people rinse out their nasal passages. It could either be with like a non-medicated saline spray or a neti pot, for instance, morning and night. That really helps remove allergens, viruses, etc. Game changer in my own personal health. And it's something I do every day, and it's cheap and easy to do. But that can really help our immune system. And then things that are so important, like foundational things we can't forget: stress management, sleep hygiene, exercise, hydration, sunshine, so some basic things that are so important. If we are really stressed, our immune system's going to be impacted. I don't know about y'all, but I remember when I was in college, before I had any of this knowledge, I would get sick after finals every single semester. So, it really is important. And I feel like it's, overlooked or underappreciated. Sleep quality and quantity. So, we really need to make sure we're adequately sleeping enough hours, but also getting good quality sleep. Are we moving our body and exercising, which helps support our lymphatics? Are we hydrating, which helps support our lymphatics as well, which plays into immunity? Are we getting sunshine to help optimize our circadian rhythm and vitamin D level? So I just threw a lot at you, but those are kind of my big things, is the basic general support that I feel like I said, is just sometimes overlooked. And then a few things like being cautious and cognizant about washing your hands, nasal hygiene, antioxidant rich diet, etc.
Yeah, I think it's really interesting that you were saying that it's underappreciated and sometimes overlooked, because I have to agree. And I think especially there's certain things in life, like when you are stressed, it doesn't necessarily show up right smack in front of your face that you're stressed. Like there can be certain things, or just burnout that you're gradually reaching and don't know you're getting there, because in that moment you feel fine. So knowing those warning signs, continuing to take care of it, and doing things like getting outside to help minimize that stress level, or different things like that. And I think sleep too is one of those things. Like I know I do this a lot to myself, where I'm like, oh, 5 hours, it's okay. It's okay. We're gonna be okay. And I just push her, like, that's fine. But actually it has a huge impact on the day following, sometimes the day even after that. And then now I'm sick, now I'm this, like it's definitely underappreciated and overlooked a lot. Myself.
Sometimes it's as simple as the basics. And, like I said, I'm so thankful we have amazing supplements we can add in to help supplement lifestyle, diet, etc. But I always tell people, like, if we don't have these basics down, sometimes well, especially people who are really sick, that are coming to me that are really sick, they're willing to do any big therapies and protocols. And I'm like, but we got to work on the basics, because if we don't work on the basics, a lot of people don't get better or fully better, or they relapse, and so it's really important to prioritize that as much as possible. I will say, side note, I work with a lot of moms. And so I always tell people, you do the best you can. And sometimes in some scenarios, in some seasons of life, you can't control that kiddos are waking you up every night. Right. Yeah. And so I think sometimes that stresses people out, hearing well, you have to sleep 7 to 9 hours and not wake up in the middle of the night. And they're like, there's no way that's happening. Right. So again, with the stress, you do the best you can to nourish yourself. Every season's going to be different, and you give yourself grace in that too. And then, the kind of with the stress management, I always tell people, we have to do something every day to support our nervous system. Mm-hmm. And if that is deep belly breath work, or if it is, talking to a loved one, getting outside, sticking your feet in the dirt, getting some sunshine, taking a hot Epsom salt bath at night. I don't care what it is. If it's 5 minutes, if it's 20 minutes, great. But that is so important.
Absolutely. Yeah. I absolutely loved your answer. I just want to say, I think you just shared so much valuable information, and all the foods you suggested, reiterating the basics, even giving those tips for nervous system support. I think this is absolutely amazing for people to get started in optimizing their immunity. I know that you already mentioned some things. Of course, we talked about stress being harmful to the immune system. But is there anything else, maybe even just everyday things that people are overlooking that they're doing or not doing that could be harming their immune system?
Yeah, so I would definitely go back to kind of everything I touched on, which I can reiterate that. So for sure, stress. And, I think when I think of stress, I think when people typically think of stress, they think of big stressors, a deadline, the loss of a loved one, whatever it is. but this could be just low end daily stress where we're living life without margin, right? We're going, one thing after the next. We have no margin. We're just completely kind of, like I said, our cup isn't full. We're pouring out from an empty cup, right? And then I also think of physical stressors too. So like illnesses or, a trauma, an infection, things like that. So mental stress, physical stress. What is your schedule looking like? And with every patient, I always talk about that. I'm like, where can we find more margin? Can you say no to something? Can you delegate something to someone else? So we got to have margin. Of course, beyond stress, poor sleep, quality or quantity. So, like I said, every season's different for everyone. And no shame, you have to give yourself grace. But are you sitting in bed scrolling on Instagram before bed, right? Getting the getting the blue light, are you working really late, which that has to happen sometimes. But if you are and you have to, like I always tell my patients, I don't have them with me here, but I wear some amber blue blocking glasses that look really nerdy, when I have to chart late, it's what I have to do. Are you trying to disconnect before bed? Instead of watching TV before bed, can you read a book, dim the lights, take a hot Epsom salt bath, have time with your loved one, whatever it is,
Mhm.
Alcohol is a big one, which a lot of times correlates with this season, right? Like family time, we're drinking more alcohol, but it does really harm and impact the immune system. Does it mean you have to have zero alcohol? No. But I would say a healthy alcohol intake, no more than a couple drinks per setting. And if we can limit that to just a couple times a week max, great. Even are you drinking, what kind of alcohol are you drinking, too? No brainer, but smoking definitely impacts the immune system, decreases the immune system. High sugar diet is a big one. And that's hard again with this season. We go into Thanksgiving and Christmas and holidays, and there's a lot of cookies and cakes. Doesn't mean you can't have any of that. But again, about balance. So, I always tell people, like, if you're going to have something sweet, try to fill up on lots of veggies, high quality protein and fat prior, and then really savor what you're having, what you're choosing, try to savor it, take small bites. And then I would say being sedentary is another one too. So not moving, not getting outside, that kind of thing. So those would probably be the biggest things that I feel like harm the immune system. Poor diet, lack of sleep, stress, not moving, not hydrating, those kind of things.
Got it. Yeah. Amazing stuff. Really easy to remember. And I think just some things like you don't have to go from like, I think one extreme to the next, like you mentioned. If people, it's already such a big part of their life to drink or to smoke, even like starting to limit those things can make a really big difference slowly. So maybe that's even a good tip.
Mm-hmm. So if you have a weak immune system, what are some of the ways that you would know that you're getting sick? Kind of like a preventative, what are seeing the signs, the symptoms? What am I looking for? So I can stop.
I think, it's a good question. It varies patient to patient. I would say pretty telltale signs are, you wake up and you're more fatigued than usual. Maybe you really foggy brain, maybe have a runny nose, scratchy sore throat, congestion. Sometimes it starts with more of a cough kind of a thing. I would say those are probably the biggest things to watch out for as far as getting sick. And we can talk about this in a minute, but if I notice any of those things in myself, that's when I'll start adding in immune support, like right at the onset.
Yeah, let's dive into that then. So once you feel those symptoms coming on, you're waking up, you're like, ooh, something doesn't feel right here. What's the next step?
Yeah. So don't forget the basics and everything we just talked about. So I keep healthy diet, trying to get out and get some sunshine, trying to stay moving, not overdoing it, that kind of thing. But personally, and what I recommend for my patients, obviously this is individualized, like please run this by your practitioner. But at the onset of feeling sick, that's when I will increase, I'll add in some supplements. So vitamin C, zinc, vitamin D, sometimes vitamin A too. And so that's kind of my go-to. There's other things that you could add in to help support, like N-acetylcysteine or some other herbs, especially if you think it's more of a viral type illness. And then so I start immune support, and then I'm making sure I'm honoring my body. Like, I'm not overdoing it. I'm resting when I need to. I'm hydrating well. I do a lot of like ginger tea with lemon personally, but there's a lot of other great teas out there, like a throat coat tea. I think Traditional Medicinals has one. That I'll recommend doing. Steam can be really helpful if there's congestion going on. So like steamy showers. I actually have a facial steamer off Amazon that I had bought a long time ago, I think more for cosmetic purposes, and I don't use it for cosmetic purposes, but I use it when I'm sick, and it's amazing to open up my sinuses. And sometimes I'll put in essential oils, like some eucalyptus oil in there too. And then, other foods, that's when maybe I ramp up more like garlic, with the antiviral good properties to it too.
Awesome tips. We are running out of a little bit of time on Zoom. We do have about 8 minutes left of this interview. So I'm gonna have Andrea jump to the last question here for you. It's all been amazing so far, but let's dive into the last one.
Okay. What is your best piece of wellness advice? Best one.
Yep, love it. So this is really simple, but do something you genuinely enjoy every day.
Oh, that's sweet.
Wow.
It is. I mean, it is. It's about, I think so often we go through life and we're just one thing to the next. And, we want to live life and live it well and have joy and happiness and kind of like what I said, overall wellness. So that is what I always tell my patients. It's always on people's plans that you have to do something that you enjoy. And that can be whatever, from one person to another, it'll differ, but just be intentional about it.
That's so lovely. That's so lovely. I love that advice, and I am so gonna do that.
Good. Perfect.
Agreed. Yeah, I think this was so valuable, and I really appreciate everything that you shared, and the way that you're helping people in your own community better themselves from the inside out and get to the root cause. Thank you so much for these amazing tips, and I'm sure so many people are going to take this into consideration and use these now going into the cold and flu season. So
perfect. Well, thank you for having me. It was so fun.
It was so fun. Thank you so much, Taylor, and we'll be in contact with you. But have a great rest of your day.
Thank you. Bye.
Bye.